start?
Yeah.
Oh, okay, sorry. VSI, so I'm safe, my partner's safe, my patient's safe, so the bystanders are safe, so the scene is safe. There doesn't appear to be any environmental hazards. There's only one patient, and it appears to be MOI, mechanism of injury, because she's lying on the floor, and I don't know what happened. There doesn't appear to be any need for additional resources, possibly ALS. Then I might need a C-spine, but that's it. So no need for additional BSI. My general impression of my patient is that she appears to be pale. I can see that she's lying on the floor, so she must have fallen somewhere. But because there's nothing around here, so I'm thinking maybe she fainted or fell or tripped. There doesn't appear to be any life threats. I don't see any blood. So hi ma'am, my name is Denise Garcia. I'm a AMT. What's your name?
Ariana Jones.
And where are we?
My sister's room.
What year is it?
2016.
And what were you doing? What happened?
I was just looking at a book and I already had a headache, but then I got really dizzy and then I just blacked out.
Okay, so you fainted.
Yes.
Okay, and then can I help you?
Yes, please.
Okay, so she was awake when I entered the room and her eyes were following me, so ABPU checks out. She was talking to me, so it shows that her airway is open. I'll check for her respiration. So her respiration sounds good. It's clear. There's I would say 13 breaths per minute. And then circulation. So her skin looks pale, cool, and clammy. There doesn't appear to be any bleeding. I don't need a capillary refill because she's not under the age of 6. And then her pulse. Okay, it would be 60 beats per minute, strong. So there doesn't appear to be any deformity or disability. She fell, so I'm exposing so your head? So exposing the area of complaint. My plan is maybe to go to keep the cabinet dim, no sirens, because it would maybe hurt her head even more. So she appears to be stable, so my plan is to get her to the hospital. So what were you doing when this happened?
I was just looking at a book.
And then, does anything make your headache go away or feel better?
Not really. Maybe if I took some ibuprofen.
Does anything make you worse?
Light.
Okay, and then, can you describe your pain to me?
Throbbing.
And then, so where's your pain? Does it seem to spread anywhere? Have you ever felt this way before?
Every now and then if I'm stressed.
Okay, sorry. On a scale from 0 to 10, 0 being no pain to 10 being the worst pain ever, like childbirth, how would you rate your pain?
A 2.
And then what time did this happen?
Like 20 minutes ago, so about 5 o'clock.
Okay, and then any symptoms?
I'm a little chilly and dizzy, and I have the headache still.
Okay, and then any allergies? Medication?
Oh man.
Do you have any past history?
I've had headaches before, but that's about it.
And then, sorry, what was your last oral intake?
Pizza.
And then, can you tell me again what were you doing?
I was looking at a book.
Okay, and then, so she's clearly female. How old are you?
18.
How much do you weigh?
110 pounds.
Do you smoke?
No.
Do you drink alcohol?
No.
And do you take any recreational drugs?
No.
Okay, and then I'm going to be checking her vital signs. So, pulse seems to be normal, no change, 60 beats per minute. Respiration seem to be normal as well. 12 breaths per minute. Is there any pain?
It's starting to fade a little, but it's still there.
Okay. Blood pressure, and it appears to be 110/70. And then her skin hasn't really changed. She's still pale, cool, and clammy. And then, so I will be checking her neurological. So she already answered A&O ×3 when I got here. And then, so I would give her a GCS score of 15 because she opened her eyes when I arrived. She talked to me and she made sense. And then, can you raise your hand for me? Okay, and then she obeys my commands. So I would be giving her 15. Now I'll be checking her Pearl. Okay, so Pearl is good, and now PMSS. Can you squeeze? Okay, closing your eyes. What am I touching?
My pinky toe finger thing.
Closing your eyes. What am I touching?
The phone.
Okay. Okay, lift up. Lift up. Lift down. Lift down. What am I touching?
My big toe.
What am I touching?
My little toe.
Okay, so neurological seems good.
My patient is stable, so I will be checking her every 15 minutes.
I will be performing a complete physical exam of my patient in the next video. To start off our detailed physical examination, I'm going to assess the head for DCAP BTLS, which is deformities, contusions, abrasions, penetrations and punctures, burns and bruises, tenderness, lacerations, and swelling and scars. So I'm going to start off with the head. I'm going to palpate for any instability, crepitus, and tenderness. I'm going to also assess for to see if the head and the face is asymmetrical. I'm going to look for any signs of raccoon eyes. I'm going to look behind the ears to see if there are battle signs. I'm going to look for soup or singed nasal hairs or facial hairs. And then I'm also going to look for coffee ground emesis. Great. Then I'm going to move on to the neck. I'm going to assess for DCAP BTLS. I'm going to palpate for any tenderness, instability, or crepitus. I'm going to check the carotid pulses. I'm going to look for any track marks and tattoos. I'm also going to be looking for any medical alert tags. I'm also looking for jugular vein distension and then tracheal deviation. I'm also going to be looking for accessory muscle use. I'm also going to look for subcutaneous emphysema and then stoma. So now that I'm done with the neck, I'm going to move on to the chest. Okay, so for the chest, I'm going to assess for DCAP BTLS. I'm going to palpate for tenderness, instability, and crepitus. I'm going to look for any paradoximal movement. Breathe. I'm going to also be looking for accessory muscle use and then a second chest wound. Okay. I'm also going to be looking for subcutaneous emphysema. Then I'm going to auscultate breath sounds in all fields of the lungs. Okay, let me just do that. Okay. So, moving on to the abdomen, I'm going to assess for DCAP BTLS. I'm going to only palpate for tenderness. I'm going to look for any signs of distension, rigidity, or guarding. I'm going to feel for a pulsating mass. I'm going to look, because my patient is a female, so I'm going to look for any signs of pregnancy and or complications. Then I'm also going to be looking for subcutaneous emphysema. I can't move. So I'm going to move on to the pelvis. I'm going to be assessing for a decap BTLS. I'm going to palpitate for tenderness, instability, and crepitus. Sorry, I'm like really tired.
Just for a moment.
So I'm going to check for the femoral pulse. Right here, right? Right here. Thanks. I'm going to check for the femoral pulse. Any incontinence, which is lack of control, so of the bladder. Then if I had a male patient, I would be looking for prepism, which is an erector. What's that thing called? Oh, whatever. So she's not a male patient, so I don't have to look for prepism. Because she's a female patient, I'm looking for any signs of pregnancy and or complications. I'm also looking for vaginal bleeding. So moving on to my lower extremities. Dude, I can't feel my legs right now. I'm gonna assess for decap BTLS. I'm going to palpitate for any tenderness, instability, or crepitus. I'm going to be looking for track marks or tattoos, any medical alert bracelets. Then I'm going to check the pedal pulses. So like pretend there's no shoes. Then I'm going to look for motor movement. So can you push down? Can you push up? Can you push down? Can you push up? Okay, which toe am I touching?
My big toe.
Okay, which toe am I touching?
My small toe. My pinky toe.
Okay. So I checked for motor movement and sensation. Then I'm going to go on to the upper extremities. Come back up. My knees. I'm going to be assessing for decap BTLS. I'm going to palpitate for any tenderness, instability, or crepitus. I'm looking for tattoos or track marks. I'm also going to be looking for any medical alert tags. Then I'm going to be checking the brachial and the radial pulses. Okay. Then I'm going to be checking for the motor movement. So can you squeeze? Okay, can you squeeze? Okay, without closing your eyes. Okay, what finger am I touching?
My pinky finger or my small finger?
So without opening your eyes, what finger am I touching?
My thumb.
Okay. I'm really tired. So I'm going to move on to the back. So okay, woman, you're like almost dead. Okay, how do I do like this? You have to go all the way.
I don't know.
Okay, so when you do your video, you gotta go. Okay, woman. That's so not happening. Put your like thing straight. There you go. Okay. I'm going to be assessing for decap BTLS. I'm going to palpitate for any tenderness, instability, or crepitus. I'm also going to be looking for tattoos. Okay. I'm going to be looking at the brachial and the radial pulses. I'm going to be looking for subcutaneous emphysema and then sacral edema. Okay, so that is our detailed physical examination.